Hi, my name is Kelly, and I'm Kelly Lynn, and I'm going to be talking about learning theories. This class is Teaching Strategies in Nursing Education with Dr. Rizzo of Aspen University. And the first thing I'm going to talk about is the behaviorist learning theory. The behaviorist learning theory is observed through a stimulus and the responses. Behaviorists observe responses to the circumstance and then they manipulate the environment in a way to elicit the intended change. This type of theory may be utilized in nursing practice because the patients may seek to engage in mind and reflection. During this type of therapy, the behaviorist either alters the stimulus condition or changes what happens afterwards. This theory will apply to those who wish to break a bad habit. Changing behavior patterns takes practice. The transfer is aided by a similar stimuli and the responses in the learning situation. Behaviorist learning is based on respondent conditioning and operant conditioning procedures. Respondent condition concentrates on the stimulus and the associations. A person who is considered a neutral stimulus may experience an awkward event in which the person begins to feel anxiety. The person feels anxious, for instance. The person feels anxious every time they are around tall men who smell like cologne. The original learning environment where the stimulus affected them happened and they developed anxiety. To extinguish or unlearn the response, the principles of respondent conditioning are utilized. The response decreases if the presentation of the conditioned stimulus is not accompanied by the unconditioned stimulus. So, for instance, the person is introduced to a tall man who doesn't smell of cologne. If the person is exposed to tall men who do not smell of cologne each time, we begin to desensitize the person. The anxiety about tall men will decrease. Systematic desensitization is used to decrease anxiety and fear. In the above case of the young woman who was initially frightened by a tall man who smelled of cologne, the assumption was that the fear and anxiety was learned at one point, and therefore it can be unlearned or extinguished. If the person is feeling relaxed and non-stressed, a person's in an environment that is conducive to learning, and over time, this desensitization takes place, eventually they are well, and the anxiety and fear leaves. Cognitive learning therapy is often utilized in the educational arena and in counseling sessions. Perceptions, thoughts, and memories are involved in cognitive learning. The way a person perceives and structures information is part of organizing information into new understanding. A reward system is not needed for learning to take place with this theory. The cognitive learning therapy includes considerations related to emotions. Each perspective concentrates on a feature of cognition. For instance, the Gestalt perspective is the principle which is directed towards simplicity, equilibrium, and regularity. Another aspect of the cognitive learning therapy is how information is processed. An example is as in the following. We have a patient that is not paying attention to the instruction of his wound care nurse. The patient is distracted. The distraction becomes a barrier to learning. The best way to increase the patient's attention span, which would be to increase the behavior, and learn how to care for their wound may be to come back at a later time. Sounds simple. Or decrease the behavior, the distraction. In the room, decrease the distraction in the room by shutting the door, turning off the TV, asking for privacy, requesting visitors or family come later time, step into the hallway, provide a quiet setting to teach the educational materials. The following are 9 events which need to happen in order for the cognitive processing to activate effective learning. We need to gain the patient's attention. Make sure they're paying attention for the process of learning to come to fruition. Inform the patient or client of the expectations. Stimulate the learner's recall of prior learning. What do they already know? Present new information. Provide guidance to facilitate information. Encourage the learner to demonstrate the skill back to the nurse or repeat the information. Provide feedback to the patient and assess the patient's performance. And work to encourage retention and transfer knowledge through application. They may have to have this done several times. The nurse will first ask the patient how they learn best. The nurse will ask them to describe what they believe they will learn. The nurse will evaluate the learner's mistakes, and the nurse will pay attention to the learner's inability to remember or demonstrate information. This is an important part. The nurse may break the information into small pieces when providing education. Use tricks or techniques for the new material so that it becomes familiar. And to put the information into context that the patient can understand. An example of this is retrieving information from long-term memory. This can be a barrier in learning. To increase learning at the initial stage, it would be helpful to break the information into these small chunks. Use memory tricks and techniques to relate the new materials to something more familiar. This helps place the new information into context. Now, with social learning, this is another theory. In the social learning theory, the learner is influenced by the social factors and the social context where the learning may occur. The learner is the central factor, and their perception of how they interpret and respond to social situations is considered. One of the observations which forms this theory is the observation that the individuals who are learning do not need direct experiences to learn. Learning comes from watching another's behavior and what the results of the behavior are. That's why it's very important with children, what they watch, right? And also the consequences of what happens to the behaviors. Role models lead the way through examples of how to feel, behave, and think. In order to facilitate learning, the role model needs to be professional, caring, and enthusiastic. Nurses have the opportunity to influence patients and nurse managers, their staff. Each nurse has the opportunity to contribute to the outcome of the clinical environment. A 4-step internal process about social learning includes role models with high status. This is interesting. Role models with high status are recognized more likely to be observed in this attentional phase. The retention phase involves the storage and retrieval of what was observed. And the 3rd phase consists of the learner copying the observed behavior. 4th phase is the motivational phase where the learner is motivated to perform the behavior. Now I'm going to give you an example. For example, a nurse manager notices the negativity which occurs within the nursing station. The nurse manager wants to see a decrease in the negativity and an increase of positivity within the workplace environment. Research indicates that those managers who are aware of their roles and responsibilities in promoting a positive work environment enhance learning, competence, and satisfaction. The nurse will role model by encouraging positive responses and positive feedback on a daily basis. It may take time, and it's not easy because that trap can be, the nurse manager can fall into that trap, but she has to actually pull herself from that trap, and she has to become a role model no matter what she's seeing. The nurse manager will spend more time in the nurse's station. She has to spend time to be a role model. She can't stay in her office. She will see a decrease in negative behavior as she role models a positive attitude on a daily basis. The negativity will decrease as the nurse manager relates to the nurses in promoting a positive work environment, enhanced learning, competence, and satisfaction. The positivity will increase as the nurse manager applies social learning principles of role modeling. So, it can be done. The psychodynamic theory is a learning theory with constructs taken from the works of Sigmund Freud. The psychodynamic perspective emphasizes the conscious and the unconscious forces informing behaviors. The id includes two components, which are of the following: the eros, which is the desire for pleasure, and the thanatos, the aggressive, destructive impulse, the death wish. The id operates using the pleasure principle. The id is in operation from the pleasure principle and from avoiding pain, wanting pleasure or sex, and encountering the id. The superego is involved in internalizing societal values and the conscience. So the ego is what we want to build up. For example, as in the following: a teenager who has altered body image related to inadequate nutrient intake, as evidenced by a low albumin level, persistent food restriction, and low body weight, may benefit from a nurse using the psychodynamic learning theory. The nurse will provide help and supportive measures in addressing the underlying issues related to the decreased nutrient intake. The nurse will discuss food intake, the increase desired, as the patient learner begins to accept support to address body image. As the patient trusts the nurse, past conflicts may be discussed for the learner to move ahead emotionally or behaviorally. Remembering that this theory involves learning and changing behaviors. It is a theory of motivation which stresses emotions. When countering the primitive drive, remember, go back to the id, the superego will appear to the values, the standards, and the conscience. When the nurse appeals to the patient through the ego, the patient learner is able to listen to reality. We want to get her in the ego so that she can listen to reality and understand what is happening to her body. The development of a healthy ego development is crucial when coping with discomfort and health problems. As the patient is brought up to speed with reality, they are able to understand the needs of their body. As we bring them in touch with the ego, they are able to hear, take that in, and understand, and then get in touch with the needs of their body. Their ability for food intake will increase, and the lack of appetite will extinguish. This is the psychodynamic learning theory. The humanistic learning theory says that each person is unique and is able to develop into a positive way. Caring and patient-centeredness are the attributes of this theory. Motivation is generated from the person's needs, subjective feelings, and the desire for personal growth. Maslow's hierarchy of needs has an effect on human motivation. Most people remember Maslow's hierarchy of needs. Our feelings and emotions are the keys to learning, communicating, and understanding. The main emphasis is on the healing nature of the therapeutic relationship and the need for nursing students and staff to grow emotionally from their healthcare experiences. The humanistic learning theory modifies the approach to education by focusing on the subjective needs of the learner. An example of this is as follows. A nurse approaches her patient to give the morning medications. The nurse notices the patient has a flat affect. The nurse begins the conversation with, "Tell me how you feel." The conversation revolves around the patient and their feelings. The basic levels of care must be met before the patient can be concerned with learning and self-actualization. The nurse acts as a facilitator, and she listens rather than talks. She provides therapeutic communication. The nurse will act as a resource and encourage the learner to make right choices. One example of this type of therapy is as follows. A patient is admitted on the inpatient mental health unit. She's a 20-year-old female, she's depressed, and to complicate matters, she's told by the staff nurse that she is pregnant. She is now confused about whether she should have an abortion. The doctor and the nurse, in a meeting, give her the news. The nurse provides therapeutic communication through listening and assisting the patient to discuss her feelings about the pregnancy. The patient is less depressed because she can acknowledge her feelings and her fear is extinguished, no matter what the outcome is. We allow the patient to recognize their feelings. The learning theories. How can the learning theories be used in combination to change behavior and enhance learning? The various learning theories have some similarities and differences. The external and internal factors affect learning singly or in combination. A few theories may provide new information for the health practitioner, while others proved insight into thoughts, feelings, and behaviors. Each theory highlights important considerations in any learning situation. For example, behaviorists urge nurses in the role of teaching others to pay attention to the surroundings and to change stimulus conditions in order to provide reinforcement to alter behavior. The ability to change one's behaviors are considered easier than changing one's personality. The desired responses are modified and strengthened through practice, and the new learned responses may indeed lead to changes in attitudes and emotions. In the case of role models, they will demonstrate exactly what is expected and received through rewards. There are so many ways of learning, and one theory cannot possibly cover all the perceptions, thoughts, and ways of processing information. And finally, when teaching within a group setting, a multiple approach of various theories may be necessary. Now, in the case of drug titration dosage, failing to follow safety protocols are often the cause of medication errors. Teaching, which includes following protocols, correct calculation of dosage formulas, the right equipment, and following the 6 rights of medication administration are crucial for safety. A link broken in any of these areas can cause great errors and even sentinel events. An educational theory practice gap exists in practice. Nurse educators often teach motor skills to their students. Motor skill education is important for medical training. One way to teach a nurse oriente who may be having trouble learning how to titrate drug dosages is to utilize techniques learned from motor learning variables. Practice is the most important factor in developing and retaining motor skills. Now, the amount, type, and variability of practice will affect how well a target skill is required and retained. The principles of learning can be successfully applied through application of motor skill education. We can take the principles and use them in teaching drug titration. The idea of titrating drugs based on physiologic data can be taught through demonstration in practicing. The amount, type, and variability of practice all affect how well this skill is attained and retained. There are various types of practice, which include, for instance, random versus blocked practice, guidance versus discovery, mental practice, and various others. Massed practice are sequence-oriented with time affected, such as in teaching students to take blood pressure readings. The same principles can be applied to this case. To promote competence in learning drug titration, one may teach a systematic approach. Critical thinking and reasoning are important factors when learning how to calculate drug titration. A weakness in cognitive learning may exist for the student as well as information processing. The cognitive learning theory emphasizes the thinking process, reasoning, the way information is stored, memorized, and retrieved. We would recommend incorporating help with the pharmacy, if possible. We would recommend that when there is trouble, another nurse, a mentor, a role model on the unit. A nurse educator will not only teach the sequence events for safety, but also teach students to utilize their resources. So we teach them to utilize their resources also. At the same time, we're going to repeat this several times and have a system. In addition, they may want to collect information about how the student best learns information. So we would ask the student what they think they should be learning. What are they learning? What do we want them to learn? What are we doing? And how do they learn best? And then we will evaluate their mistakes. Self-efficacy theory versus the attribution theory. In order to counsel a student who is failing a nursing course, the nurse educator will want to consider the educational approach. One such approach could include the nurse educator listening to the student, as this would be a priority when first meeting the student. I don't want to just say, I know you're failing, let me show you some tips I want to listen to the student. I want them to tell me what's going on. This theory takes into effect the attribution theory. The focus is mainly on the cause and effect. This theory takes into effect cultural values and beliefs. Internalizing blame for their failure or externalizing the blame for their failure may be the cause of the problem. For instance, the student tells the nurse educator that their failure in the course is because they believe they're being punished for their sins, or externally that the political climate has caused them to fail. These perspectives may or may not promote wellness and well-being. The way to change these patterns of thinking is to change distorted attributions. The nurse and the patient may both need to have the attributions changed, even the nurse, or modified. The self-efficacy theory comes from an expectation related to an action. This theory says that the person is competent, the student is competent and capable of a specific behavior. When a person is told that they are competent, they can overcome this. Now, obviously, we have to put those strategies into place. It's a different way of looking at this. This theory says that the certain behaviors will produce expected outcomes. There are 4 principles surrounding this theory, and they are as follows. The performance is connected to expected behaviors. Vicarious experiences occur through modeling successful behaviors from others. Persuasion from others helps to bring realistic beliefs or expected behaviors to one, and emotional feelings of distress are brought about through self-judgment. The teaching strategies of role modeling, demonstration, and verbal reinforcement are key factors when developing educational programs. So they actually use this in educational programs, and it's something that a nurse instructor may put into practice when wanting to help a student who is struggling in a nursing course. Utilizing the social cognitive learning therapy as a clinical preceptor. The social learning therapy facilitates the identification of perception, how the information is interpreted, and the response to social situations. The clinical preceptor will question what the nurse is learning, perceiving, and how they are interpreting the information, particularly in social situations. The healthcare environment serves as a fishbowl of learning. According to the authors, Billings and Halstead, I'll quote them here, preceptors have a specific role in modeling and facilitating clinical education for students, and nurse preceptors should be oriented to the role and evaluation process of a clinical preceptor. The education is provided from other individuals and role models. This theory may help to assist the clinical preceptor through ensuring safety measures demonstrated by others, sharing feelings, challenging one another, providing guidance from one another, and demonstrating competence as they work on the floor together. It's an iron sharpens iron kind of deal. The nurse learner is central to what is happening around them and how the individual responds to the learning environment. This social environment is a successful environment if done right with the nursing clinical preceptor. The many attributes of successful nursing teachers include being present for their students, staying current in the nursing discipline and in teaching strategies. Successful nurse educators will find meaning in education and in teaching students. Passion and an interest in teaching are hallmark in nursing education. Thank you very much.